Hi there, this is Allison with Let's Go Travel Tips. Today I'm going to talk to you a little bit about travel insurance. So I am not going to give you counsel on what insurance to buy or that you have to or anything at all like that. I am not an insurance broker or anything. I'm just going to tell you what we have always done when we have cruised with Princess. And as you know, we have only cruised with Princess, but we have cruised with them many times. And so just to start off, the main reasons that you want to get travel insurance are so that if you unexpectedly have to cancel your cruise for any reason, then you can get your fare back, and they usually give it back to you as future cruise credits, but that is better than losing all of your money. And then another really important reason to get travel insurance is so that if you have any unexpected medical expenses or an unexpected medical evacuation, like they have to remove you from the ship on a helicopter, then that is covered by the insurance, and that is really expensive. In doing my research for this and what my husband and I had looked at before, a medical evacuation can cost like $50,000 and up. And so it's a lot of money. And so that's why we have always gotten the insurance, because it's nice to get your cruise fare back if you have to unexpectedly cancel for some reason. But that is more manageable than having to pay for medical evacuation or for huge medical expenses if something happens and you have a lot of medical bills. And so those are the main reasons that you need medical insurance, and it's the main reason that we always get it. And so I'm going to tell you about Princess's plan really quick that we always use, and then also another insurance place that you can go to get trip insurance. So first of all, with Princess, they have the Princess Value Protection Insurance, and they have the standard plan and the premium plan. And we have always gotten the premium plan, and it is just 1% of how much your cruise fare is. And so that's just the easiest way for you to know what it is. And so first of all, it covers, like, if you have to unexpectedly cancel your cruise, like if someone dies or anything happens and you're within that window of not being able to cancel, it just covers so that you will get your fare back. And so that is really nice. And like I said, sometimes that is part of future cruise credits that you get, but that's okay. And then also if you have to have your trip interrupted or any delay and you end up staying in a hotel or anything like that and it takes longer to go or anything unexpected happens, they also cover that. And then also, like I said, the medical expenses if you get sick or the medical evacuation, and it also covers like your repatriation. So if you get sick and you are cruising like somewhere off the coast of Europe, and so they take you there and then you've got to be flown back to the United States for healthcare, that goes with it. And so that is also a very expensive thing to have, and so that is really an important thing. And then the other thing that all of the plans offer is a little bit of coverage towards if your baggage gets lost and then you have to buy new things. And so that right there is a good reason. Like, we always keep all of our camera gear with us. We keep just, our laptops with us. You wouldn't pack things like that. Don't pack your nice jewelry in your suitcase, because then if it gets lost, you're still okay and you just have to replace like some toiletries and some clothes. But anyway, those are the kind of things that it covers. And really, like I said, the big difference between the two plans with Princess is how much it covers. And we always get the premium one just so that we have the extra coverage, and it's $100 and something. It's not, or maybe a little bit more for a more expensive cruise, but it's not outlandish. Now, the other thing that is really important these days when you think about it is with COVID, because COVID has like brought this whole new level of concern about medical costs to us, because it used to be, you would be concerned if you unexpectedly became very ill on the ship, and you would think, well, I don't have a heart problem and I'm not that old or anything, any of the risk factors that you would usually consider. But now with COVID, if you test positive, you have to get off the ship, and then you have to be quarantined somewhere, and then you have to go be flown back to the United States. And in the best case scenario, if you're not really sick with it, you still have to go through those steps to get back to the United States from another place other than just coming back to the port like you expected. But if you have medical expenses that go with that, they can easily get really high. And so it's really important, I think, these days to always have travel insurance. Before, I think it would be up to the more risk-averse person would get the travel insurance, but now I think it's really important that everyone does, because it is really a huge risk, and it really mitigates it. It just makes it so you don't have to worry about it anymore. So the other company that we have used before for other travel is called Allianz. It's ALLIANZ, and I'll try to remember to leave the link below. And they just offer travel insurance. They do it for people like for cruisers, but they also do it like for business executives that travel a lot, and for people that just are going on a big trip. They have a lot of different things that you can pick from their coverage. But the really nice thing about going through them is if you are a person that goes like on lots of cruises every year, you can pay one annual amount and it will cover you on all of those. And so take a look at their website. All they have you do is they just put in like the state where you live, and they have you put in your age, and like, so for us, I put in both my age and my husband's age, and just like where you're cruising from, they ask different information depending on what insurance it is that you want, but then they will just bring back a quote to you. And so in looking at it, I thought that like if you were going to sail one time, the one-time trip for the very highest coverage is $174, and based on they base it on just like I said, one trip, but that's for their prime, and then it's a little bit cheaper for the ones that cover less. Like for example, the one that's $174 would cover, for the COVID things, and also for your trip cancellation and your trip interruption and your emergency medical, they would cover $50,000 worth. But on the lowest coverage one, they don't cover your emergency travel. They just cover trip cancellation or trip interruption. And so you have to be really careful that you get a plan that covers what you need it to cover. And so like that cheaper plan would be really for people that think they only want coverage for COVID stuff, and that they only want coverage if their trip gets canceled. And so if you are someone and you would like to have your medical expenses all covered if something else happens, or you need a medical evacuation, you would get the higher plan. But it's really easy. You just go onto their website and you fill in the information, and it will pop up and give you lots of different options. And the thing I thought was interesting, just based on the information I put in that popped up the $174 for a one-time trip, the whole year would be $485. And so see why it's a really good plan. If you are going to sail lots of times, you would save money by just going to this place. But it's really important that you kind of look at all the different coverages and everything that applies to you before you really pick. Don't just say, oh yeah, that is cheaper to pay for a year. Make sure that you know what the differences are in the coverage between that one and what you get every time you go on a Princess one, or get the insurance with another cruise line. And so just pay attention. But I would say you really should get some travel insurance whenever you go, because you never know what's going to happen anymore. And in these COVID times, things just seem to change so quickly, and we just want to be prepared so that we don't have to worry so much. And then if something does happen, then your worry is not taken up by worrying about how you're going to pay for it or manage things like that. You can just focus on getting better or taking good care of whoever you're with. And so those are really my thoughts. If you have any questions about it, don't hesitate to ask me. If you want to look at princesses, you just go to princess.com and scroll down on that main page there, and at the bottom I think it says travel insurance. You will recognize it. It's something like travel insurance, and you can click on it and it brings you up, and it brings up all the information for you so that you can see it and then kind of decide what you would like to get. And then, like I said, there's that other website that you can compare, and there are other insurance brokers that offer travel insurance as well. And so you can go wherever you would like. Just make sure that they're a highly rated firm so that if anything happens, you really do get that money that you're paying for.
We're going to Alabama.
Wow. So,
Very exciting.
Gulf Shores.
Yes.
We booked a beachfront condo in a low-rise building, and we'll be able to see the dolphins swim by according to the description.
Yeah, it sounds wonderful, doesn't it, Norm? We're very excited.
But it did throw up some problems for us, didn't it, Tim? Because, are we insured to go on a trip? So what did we find out, Tim?
Well, we did a whole pile of research, didn't we, Norm?
We did.
And perhaps you can enlighten on the tribulations of us going.
Okay, so basically, we didn't know if our travel plan covered COVID-19, catching it while away on holiday, or not being able to get back into the country because we test positive. Because at the moment there still is a testing requirement.
Yes.
So we called the insurance company and had a very extensive chat with a person who totally surprised us. By what did he say?
He said we were already covered for COVID.
On our existing policy.
And because we thought we would have to buy additional COVID coverage, didn't we?
And the reason why we called our insurance company is because we went online to get quotes for travel insurance for this trip specifically.
Yeah.
And that really shocked us.
That was the biggest surprise, wasn't it? All the things we found out, wasn't it, Norm?
It was. So it seems that me being over 65, most travel insurance policies of the popular companies that you might try won't insure two people. If one's over 65, you have to have a policy each.
Yeah, we had no idea about that, did we? We've always been used to being insured as a couple, haven't we?
And so then I started doing a policy for me. And then it said, oh, you're over 65. We don't do online policies for
over 60. So Norm was kind of feeling, ooh, I'm getting up there now.
Yeah, so basically after doing about 4 applications, we did get some quotes and they were outrageously expensive. And this was just for a 1 month trip.
Yeah, not endless trips, was it? It was just the 1 month trip.
So that prompted us, let's call our existing policy and see whether we are covered or not. Mm-hmm. And for our policy, this company, we should say that we have the Bank of Montreal MasterCard travel and medical insurance.
Yes.
And it's actually called the BMO Total Travel and Medical Protection Plan. And that's their top of the line plan. We've had this for over 20 years, so we've been grandfathered into our 31 days per trip. We believe now it's down to about 19 days per trip.
Yeah, he actually said it was a great deal that we had, didn't we? Because we still got the 31 days.
So we can never give this credit card up.
No, we got to keep spending, Norm. Yay!
So anyway, one of the things that on a previous video, we had a viewer relate a story to us, and we thought, and he asked us to do this subject for a video, which we were very grateful for the suggestion, and we think it's very important. So Tim, why don't you take that away?
Okay, so it was a great story by one of our viewers called Doug. And basically, he told us that a couple of weeks ago, he and his wife, both in their 60s, had gone down to Costa Rica for their son's wedding. And also his mother-in-law had gone with them. And unfortunately, she had a heart attack when they were down there. Now, she was 76. And although he said that the medical care was awesome in Costa Rica,
That's good to hear.
Yeah, that is. She was in hospital there for a week and a half. Then the mother-in-law and his wife were air ambulanced back to Ontario. And he said that the cost while she was in the hospital was $98,000 US.
That's just for a week and a half.
in the hospital, added the cost of the air ambulance, which he thought was around 25,000 US dollars. So he is thinking that the whole thing would be translated to about 200,000 Canadian dollars for the treatment, the hospital stay, the air ambulance, and everything.
But they had travel medical insurance, didn't they?
They did. Now, he did say there was a slight problem to begin with the company because they weren't familiar with the hospital in Costa Rica, but they got that sorted out and it got taken care of and everything was paid.
But how much was the policy that paid out 200,000 Canadian? How much did it cost this lady at 76 years of old?
It cost $160 Canadian.
Man, wasn't that the best investment ever?
I mean, just can't imagine, had she not have bought that policy, they could have been in financial ruins, couldn't they?
Yeah,
just awful.
This is getting into territory where you have to sell your house to pay these bills off.
And basically, he told us this story and asked us that it might be a really good topic to do for everybody else to be aware of.
Totally true, Dana.
Yeah, great.
Now, we would really like to sort of talk to those of you in your 40s and 50s and say, get a travel medical insurance policy now for your next trip, and have an annual policy so you can do multiple trips in the year. It's the most cost-effective way to have travel insurance. But the thing is, you've heard that we're grandfathered into our policy, that they've never changed that in the 20 years that we've had it.
No.
So you need to get in on that so you can be grandfathered in for when you're retired. Because if you wait till retirement, and let's face it, a lot of us want to travel in retirement. That's part of the fun, isn't it?
Yeah, absolutely.
It's too late to buy travel insurance in your 60s.
You need to have got it before then, don't you?
It's going to be super expensive.
Yeah.
Whereas if you picked it up in your 50s or your 40s, it's way more cost effective. How much are we paying for our plan, Dean?
Well, we started off, Norm, paying about $125 a year. And what happens is basically once you get to 60 and every 5 years after it goes up. So we paid more at 60. Now we're on our 65 level and we're paying $326 a year. But that's for both of us.
Yeah, it is.
For as many trips as we want in a year, unlimited trips in a year, as long as they're under 31 days.
Now, there is a little trick that you found out, that we can get a top-up policy, which we didn't realize for this, because the Bank of Montreal, BMO, with this travel plan, use Alliance to underwrite it. So that's the ALLIANZ. Z from England.
Yeah, the Alliance. Alliance.
And Tina called them a couple of years back when we were going to be away for 60 days in Portugal. And they said that they couldn't do a top-up at that point. So Tina called around, and I think we've told you before, found that TD Bank, through the TD Insurance, offered a top-up that would piggyback on our Bank of Montreal travel plan. So that's what we did.
Yeah.
So maybe that's something that you need to look into if you're looking for beyond 30 days or 19 days, is look to get a top-up plan.
But also, Norm, remember that because we were calling about the COVID now, we started to re-talk about this same top-up policy, didn't we?
Yeah.
And now things seem to have changed, and now we can actually now get it with our existing policy. And the gentleman we were talking to said that it is considerably cheaper to now get this top-up than if we were to go for a standalone policy for, say, 60 days.
Yeah.
And so that's what we're going to do if it's a longer trip, isn't it?
It is.
And
we never travel without travel insurance. And we like this total travel and medical protection plan from the Bank of Montreal because it's all-encompassing. There's death benefits, there's lost luggage, there's delay,
Covers everything,
cancellation,
yeah.
and of course the medical.
Yeah.
And one of the biggest tips that we would have you look into is to make sure that A, you can get evacuation with your travel medical plan. So on our policy, they take you to a local hospital, stabilize you. If you need more intensive care, then they will get an air ambulance for you, and they'll pay for a nurse to travel with you.
Yeah, so we could be brought back to Ontario, wouldn't we?
That's very important.
Yeah,
and the other point is, do they have multilingual claims or people in the control centres? So you call the 1-800 number when one of you gets ill and you talk to an agent. Well, you need one that have multilingual agents, because like this hospital in Costa Rica, they're used speaking English to them. So that would be another tip.
And that was a big plus that we found out, that the one that we're with has 24-hour service, and I think they speak 7 different languages.
Right.
Which is wonderful, because, you know, heaven forbid something happens and you're away in a foreign country. The last thing on your mind is you're already in a panic situation because somebody's ill. You need to be able to talk to somebody in English, don't you?
Yeah.
I think that's very important.
Well certainly the insurance company needs to be able to speak to the administrators of the hospital, so that you're not having to bring your credit card out and pay as you go. So we really just wanted to throw the spotlight on travel insurance, because I'm sure you're like us, that you're thinking this might be the year to go traveling again.
Yes.
And it's a great opportunity to just think about travel insurance before we all hit the road.
Yeah.
Make sure that we're covered well enough,
Yes.
and that we can afford it.
So we think it's really, really important, don't we?